Hello, my badass friends. My name is Cece. Welcome to my badass life. Today, we are going to talk about health insurance. So, it is almost the beginning of a new year, and it is once again time to enroll in our health insurance benefits. Now, just to give you a couple of pieces of information that will help this conversation. The first is that we retired toward the end of my treatment, and so we were on COBRA from Doc's employer for the first year, and then we switched to a plan in the marketplace after that. And the marketplace is the Affordable Care Act. It's where you go in your state if you are basically without health insurance, need health insurance, don't have employer provided health insurance, or in our case, you are in between the age of retirement, because we retired early, and Medicare age, which we are. So we're in that gap. And so last year we did a plan through Anthem Blue Cross Blue Shield through the marketplace. And while it was an okay plan, it definitely wasn't, the best plan. And the biggest challenges, and this is part of the reason why we're having this conversation today. A couple of the challenges. And actually, I just found this out, didn't know this, but any plan that you get from the marketplace only covers you in the state that you live in unless you have an emergency. So that means if you needed just a doctor's visit while you're traveling someplace, like for instance, right now I am in Tennessee visiting my in-laws, that if I needed anything in order to get care that I don't have to pay for out of pocket and that would be covered by my health insurance plan, I would actually have to go to a hospital emergency room, which seems like a bit of overkill for a hangnail, don't you think? But that is how it works. So that's interesting. And then here's the other situation. So right now we are reevaluating plans because while we are retired and while Doc is retired from the corporate world, we still have a coaching and consulting business that we run. We do executive coaching, leadership development, and we work with families on family governance and the transition of family assets from one generation to the next. And so we do still have a small amount of clients doing that work. So we're semi-retired. But because we own that business, we decided this year to take a look at some of the plans that we might be able to get through the business as opposed to doing the plans through the ACA plans through the marketplace. And for those of you who don't understand the acronym ACA, most of you would think of it as Obamacare. And so we are looking into plans that we could get for the business. So now here are the catch-22s there. The business is owned by both of us, and so there are two employees in the business. However, those employees happen to be married, and so we have a couple of options. One is we can look at business coverage as a married couple who owns a business, except that then we would have to have two more employees in order to qualify for a small business plan. At least this is what we've been told by the insurance brokers. And by the way, that's a whole other thing, dealing with insurance brokers, because some of them really know their stuff and some of them really do not. And we are people who do a lot of research and a lot of homework. And we both have HR background. So we actually do know some of our stuff. So we ask some tough questions, and a lot of times the brokers can't answer those questions. So I digress, but I'm going to come back. So insurance plans for the business. So we can look at plans as a married couple, but then we would have to have two more employees, and we're not going to do that. And or we can look at a business plan where both of us would then get an individual plan underneath the umbrella of the business, which is fine, except that in doing that, the plans would be significantly more expensive. And so either way, there's this catch-22, right? So then we go back to, well, do we just go back to the marketplace again? But again, the caveat with the marketplace is you can only get a plan that covers you in your state and unless you have an emergency. And we travel a lot, as you know, because right now I'm in the van, no Dick Van Dyke, hashtag no Dick Van Dyke. And right now we are posting our hashtag holiday tour 2023, in case you're interested, at CCnDoc. our social media presence. And so so going back to the idea of going into the marketplace, here's the other challenge with the marketplace is this: the marketplace will also then make it so that our plans our plans can actually be very expensive through the marketplace. Not everybody knows this. Unless you have an income level that qualifies you for subsidies in the marketplace plans can actually still be pretty expensive. And so that's a consideration. And then there is another consideration, which quite honestly has just escaped me, and I'm sure it will come back to me, and we will get back to that. So then here's the other kicker. So when you call and you talk to a broker, they don't want you to go through the marketplace. It's kind of interesting. They kind of talk you out of the marketplace. And because we're finding these challenges with getting plans as a small business, they want us to get private insurance. And I can't get private insurance because here's the difference between the marketplace and private insurance. The marketplace does not allow discrimination for pre-existing conditions, i.e., cancer, but private plans can still say, no, you don't qualify because you had cancer. And so what we've found is that there's no way that I at least can qualify for a private healthcare plan, because even though I'm in remission, that doesn't count for 5 to 10 years. Now, here's the funny thing about that. The medical community says that after 5 years, which I'm not close to that yet, but I will be someday. The medical community says that after 5 years, I am cured, and it's just like a reset. Like I never had a problem to start with. Like there was never a diagnosis of cancer to start with. And yet the healthcare community, and this is both for healthcare insurance and life insurance, by the way, you cannot qualify for private healthcare insurance or life insurance until you are 10 years clear in most cases. So even though the medical community says completely cured after 5, the insurance community says not until 10. So there's that catch-22. And private insurance plans cost even more than marketplace plans and even more than business plans. So we are in a bit of a pickle right now. And by the way, this is just super indicative of what a lot of cancer survivors go through, and actually anybody with pre-existing conditions goes through in terms of trying to get quality healthcare insurance. I remember what my other point was about the marketplace plan. So the marketplace plan, because we live in a very rural area, we can only qualify for plans from Blue Cross Blue Shield Anthem. Almost all of the Anthem plans, I have yet to come across one that does. Almost all the Anthem plans do not have any out-of-network coverage. And what that means is that not only do they not approve anything that's out of network, but they also don't count any payments for out-of-network medical procedures or processes or treatments toward your out-of-pocket deductible, which basically means you're on the hook for those things. So for instance, I get a test called the Guardant Reveal, which is a liquid biopsy. It detects any circulating tumor DNA in your blood, and it does so long before any symptoms or any regular scans could do so. Like it detects the most microscopic itty bitty bit of cancer in the blood. And actually after 4 of those the more of those tests that come back negative, the more exponentially your chances of not having a recurrence are. It's an amazing technology. However, most insurance companies don't cover it. Therefore, it's also out of network. And so in my case, since being in remission, I have had $30,000 worth of those tests, because every test is $5,000 a pop, not covered, doesn't apply to my out of network. It doesn't apply to my out of pocket at all. And so I'm on the hook for that money unless I can qualify, and some people can qualify for a subsidy. So unless you can qualify for a subsidy from Guardant themselves, then you don't qualify. So that's right off the top. So that doesn't count my what I pay in premiums, and that doesn't and then I can't get any of that paid for. So this is why we're kind of trying to look at other options outside of the marketplace, because if we could get a business plan, then we could be eligible for United Healthcare, and United Healthcare tends to have a little bit more out-of-network coverage, or at least it applies towards your out-of-pocket. But again, you see the challenge of getting the business plan too. So I know that so many of you go through this when you're looking for health insurance, and especially people with pre-existing conditions, people with autoimmune disorders, people with diabetes, people with heart conditions, and of course, cancer. People go through this all the time. And irregardless of your, is that really a word? Regardless of your perspective, your political affiliations, and all of those things. This is so not about that. This is about health. This is about health and well-being. It's not any of those other things. It's just really important to know what people have to go through to get policies, insurance policies that will cover them. And I'm just going to share, I have paid a lot over the years for my insurance, including on my corporate plans. Those were never free. We've always paid a lot for our coverage. And yes, it was totally our choice to retire early. And we did the math on that. And yet, there is sort of an unknown of insurance plans, and every year the costs of those plans go up as well. So whereas last year's plan cost X amount of dollars, this year's plan costs X plus whatever the additional is this year. So my only point in having this conversation today is just, first of all, know your options, research your options, find somebody who's knowledgeable and understanding and who can also factor in any situations or conditions that you have. Look into what all the options available to you are, and then pick the best choice that you can for yourself, and do the best you can with that. I know people going through this journey who have no insurance, and that's even more challenging. But and certainly, I'm not advocating for socialized medicine. I'm not advocating for anything like that. I'm just saying that sometimes in the grand scheme of things, it does look as if our insurance, our healthcare system has some issues that really need to be fixed. I don't know what the answer to that is. And clearly, if anybody knew what the answer to that is, they would have been fixed a long time ago. I don't know what the answer to that is. I'm just saying that the average person who has to go through this process every year, including people on Medicare who have to choose their supplements, who may not be so tech savvy or have a background in HR, really, really have a lot to deal with. And so if you know somebody in this situation, and you're somebody who has a little bit of knowledge and can help them out, please offer to give them some help, and help them navigate what is really, really a very, very challenging landscape. In the meantime, that means that all of us just have to stay freaking healthy for the rest of our lives. And I plan on doing that for at least the next 50 years. That makes me 105 at death, and I'm okay with that. So take care of each other, take care of yourselves, and I wish you health and happiness for the rest of this crazy year of 2023. Quick PS here for everybody. As most of you know, I am part of an LGBTQ couple, and so that can sometimes make things even more challenging. And one of the reasons that I bring that up is because I was super shocked yesterday when we went out to investigate employer plans that we had the option to decide whether we were willing to provide same-sex couple coverage or not, which surprised the hell out of me because nationally, federally, gay marriage is legal. And so that was a surprise. And so, yes, there's a lot of things to navigate on the LGBTQ landscape as well, if you are a member of that community. And this is not a political statement. It's just simply this is who I am. This is my life statement. And just found that surprising.